call the Perry County Health Department board meeting to order. The first item is the approval of minutes from the last meeting. You should find those in your packet.
The recording was very, very hard to hear, so I tried to get as much of it as I could.
So what, were you here?
He was in the budget meeting.
Okay.
That's just an amendment that I have to be made. It says present on there.
Let me take Corey off there. Wasn't present.
And Carla wasn't.
Yeah, it says absent. Dr. Markham, or Dr. Rogan.
Oh, sorry. I don't have glasses either.
I was like, wait a minute, did I do that wrong?
Oh, that's
Board members present.
But she has absent right there.
Oh, it's just not bold. I see. My apologies.
Me too. I couldn't see there.
And it's been an issue in the past for Brandy and Erica. If you guys want to continue on the board, make sure you submit that application online for that form, or you won't be considered moving forward.
Someone shared that with me, or is there somewhere particular to go to find that?
It's on the Perry County website. There's a pop-up that comes up.
I can text you the link.
Cool, yeah, that'd be great.
Sure. If there are no changes to the minutes from the last meeting, I'll entertain a motion to accept them.
Motion to accept.
And do I have a second?
One second.
All right, we'll move on to health department business. Mallory and Donnell. First off is the HFI deadlines that we have. We got this from state. The 2026 HFI budgets have to be submitted by December the 10th, which is next Wednesday. So if there's any revisions, it's due then. And then our 2024 annual report to REDCap is due on December 30th. We have to get that sent in. So. And all core services data for 2025 need to be submitted by December 30th. And we still have one out there hanging. We've not got a core service for yet.
Ambulance?
Yes, still waiting on that. And that was the next one, 2025, the HFI core service for the ambulance. Kelly, have you heard anything about it? Or Corey, have you guys heard anything about a core service being attached to that?
No.
No.
Okay.
I know Kelly Harding said she had it. I thought she was planning on sending it to Tara. I don't know if she did.
That was back in September. We're still waiting for it.
It never came. Okay.
Nope. And she's asked multiple times before she even left. She sent out an email. And the next one is our 2026 HFI. We have a remaining balance. Kelly pointed this out because I totally missed it. We ended up getting an extra $1,300 for the 2026. And I just ended up sticking it in with our car seat line item. So if we need to change it, we can change it afterwards. We can always transfer it to wherever we need it, but we usually use car seats quite a bit. We go through a lot of car seats and pack and plays. So that's where I put that amount. And number 4, I'll let Kelly just do number 4.
Before we move on, the HFI on has the 2026 budget been submitted already as it was?
A temporary, yeah.
So who will do that?
it's supposed to be our supervisor that does that, so I'm not sure yet. So Kelly, Markram, me,
You guys will-
Mallory, we'll all do it together and go, because nothing's changed on it except that
Except for that
1372.
1300.
And then, I will add that in and then I will email it to Kelly and then it'll go probably to all of the board members.
We can't get the 2026 funds released until we report on the 2025.
Right.
So that additional appropriation that we received in dollars has to go somewhere. And since car seats, I mean, that's really only 13 car seats if we think about it. And you guys give them away after typically every accident, unfortunately. And sometimes every newborn that comes this direction. So I don't know that it'll necessarily end up being moved anyplace else, honestly.
And Catholic Charities does this a lot because they don't have the funds anymore for it.
And a lot of the times, I think people have brought in car seats from Catholic Charities that was expired. But they just needed something to put their child in to transport them safely. So,
And I think you guys are still doing car seat checks. So when you're doing
Yes.
those checks and you find one that's expired, you're just going ahead and switching it out
Switch it out,
if
yeah.
it qualifies.
Yeah, I destroy it, throw it in I cut all the belts and everything off, bag it, and then give them a brand new one.
we actually had one that was coming in to get a car seat for one of her children, and I checked her other car seat and it was expired too. So she left with two that day. So.
Yep.
And then board members.
And then Kelly will do the her form.
Before we move on to that, I do want to kind of talk about the 2025 HFI core service for the ambulance, and I'd like some discussion around that if possible. Since we haven't received a response from the council as to where or which core service that we want to apply that to, I feel like we should probably make a recommendation in writing to them and see if we can get them to respond so that we can finalize the reporting that we need to get done. 'Cause we're coming up on those deadlines pretty quickly, and I'm not sure about all of you, but December goes like that. And I don't want to get to the end of the year and not have a response from them. So does anybody have any suggestions as to what we should suggest?
So,
To the council, you mean?
Mhm. Yeah, I feel like we as a board need to make a recommendation that because the money has been moved back to 1160. Because it was originally transferred out and it's been put back, but we still need to tie that $30,000 to a core service. So, I was thinking health-related areas during emergencies and disasters, but there's gonna have to be some clarity around a plan specific to that. An ambulance in and of itself doesn't meet the definition of preventive care unless it's used in situations where it can prevent trauma or it can aid in a disaster.
I don't have the KPIs in front of me to contemplate that, but my only thought is I know Kelly Harding said that she had it all lined out, talked to the state and had it and was just waiting for the right person, I believe. I thought it was going to Tara, so I don't know if she was waiting for a supervisor or so. I'm just curious if we can just request it, if she will.
I get Tara's emails,
Send
all her emails that she left and have not received anything.
I mean, I don't care to make a formal
Yeah, that
request
was-
again. Should we make a formal request again rather than making a suggestion?
Because she had alluded to that the information she had came from somebody at the state level who helped her work through that. So I just would hate to sit here and recreate the wheel if the work's by chance already done. I haven't seen it, I don't know that.
I believe her list was how an ambulance was preventative. And like you said in the meeting, there's many ways that it can be, that people see preventative.
Yeah.
Depending on health, and when you're in healthcare, you see it as preventing an injury and stuff like that. But like doing cholesterol checks so you don't have a heart attack. But I see it both ways as to how she could see that it is preventative. But I don't think that's the preventative way that they're looking for.
Because we have to have that actually ASAP. by next week.
Otherwise, we won't be able to submit it.
We can't submit our 2025, which is gonna put us in trouble with the state. We don't want any of that. So we have to have a core service. If not, I'm not sure what we're supposed to do. I'd have to call and find out.
So it was originally submitted with a temporary placeholder of linkage as the core service. And I don't really personally feel like that's appropriate at
No,
all.
because I think we had to put something in there just to be able to, this is more of like
To move on to the
to
next.
move on, to be able to, yes. And I'm not for sure if the council understood, we had to. We're not picking, that's not the core service we picked. We just had to put something there to, as a placeholder until they put something in there. And we still haven't got that.
So is the preference of the majority that we just send an email to Kelly and we ask her to address that before Friday? Since we
Mhm.
need to get this done by
I think
next
that's fair.
Thursday. Okay. Is it all right if I send the email from my personal email and copy all of the board members?
Sounds great to me.
Okay, I'll do that this evening so that that's done. Now we can move on to number 4. We have a number of board members who have not routinely been participating or attending for one reason or another. And we really need active participation in our board. So I'd like to go ahead and submit a formal request to the council and commissioners that they advertise to replace the positions that are, of those individuals who are not meeting the appropriate criteria. Questions?
Approximately how many that is?
I will make a motion for both of those to be recommended to the commissioners to be removed and replaced.
I'll second.
Okay. Is there any other business?
I'm just gonna say that we have given since September 24th to today, we've given almost 500 flu and COVID vaccines. Which is really good, I feel like. For not having our drive-through.
Yeah, so, and we do walk-ins on Wednesdays from 9 to 11:30 and 1 to 4 for flu and COVID. You don't have to do an appointment, just bring your insurance and we can get you through.
How does that compare to previous years? Do you know by chance?
I could probably find
Oh, yeah, a little behind usual.
numbers. But I feel like we definitely did more in the drive-through. It was more convenient. Obviously, if we have someone who can't get out of the vehicle, I just go out to them. They'll have a friend or somebody, a daughter or whatever that comes in and we'll get their paperwork and take it back out to them and then I'll go out to the car to them. So.
Thank you for taking the extra effort to do that.
Yes. Not a problem at all.
Does anyone have any other business for this meeting? If not, we'll entertain a motion to adjourn the meeting.
So moved.
Can we have a second?
Second.
Thank you.
I cannot see that.